All right, so we are going to get started. So, hello everyone, Assalamu alaikum. My name is Hamad, and I'm the Director of Education at the Institute for Muslim Mental Health. So, we welcome you all to the Meet the Experts webinar series, and this is the public webinar series. So, the Institute for Muslim Mental Health, we are committed to expanding educational programming. Our goal is to focus on timely topics to improve the delivery of mental health services to the Muslim community. These webinars are intended to assist the Muslim and non-Muslim communities, as well as mental health professionals, in better understanding mental health challenges with Muslims and to increase knowledge on various topics by mental health experts. So we have various topics that we cover in our mental health Meet the Expert webinar series, which include opiate addiction, spiritual abuse, sexual trauma, domestic violence, and much more. So today we are presenting Unlocking Inner Strength, Empowering Muslims Through Therapy Engagement by Dr. Fahad Khan. Dr. Fahad Khan, he is a licensed clinical psychologist with a doctorate in clinical psychology and a master's degree in biomedical sciences. He's also been a student of religious studies, beginning with his memorization of the Quran at the age of 16. He currently serves as the deputy director at Khalil Center, providing psychological services while supervising clinical and research work. So before we get started, I just want to go over a little housekeeping rules. So first of all, if everyone can please keep your audio on mute at all times. And then also the first 15 minutes will be the presentation by Dr. Fahad Khan. The remaining 15 minutes will be for Q&A. So if you have any questions during the presentation, please type them into the question box in your Zoom control panel. And then we will, me and as well as some of the other co-hosts, we will read through them and then we will ask Dr. Khan the questions that you have posted. If we don't get to them, Dr. Khan will put his email address in the chat box, so you are more than welcome to email him directly after the webinar ends. Also, just so you all know, the webinar is recorded. Because this is the public webinar, it will be posted on our social media accounts and the Institute for Muslim Mental Health YouTube channel. So without further ado, please welcome Dr. Fahad Khan.
جزاك الله خير حماد. بسم الله والحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. Again, thank you to the Institute of Muslim Mental Health and those who are organizing, Dr. Hamada, Hamad, and others for arranging this, and those who are attending, and maybe those who will listen to it later, inshallah. You know, as someone who's been in the field for a while, especially through the Khalil Center, throughout the years, we've noticed a change in the perception of especially the Chicago Muslim community, Chicagoland Muslim community, because I think the presence of institutes like Khalil Center and others, that there has been a more acceptance and more high demand for therapy. When we first started out, you know, it was very difficult to talk to people about what therapy is. Try to engage the community in therapy and acceptance of therapy. COVID also was a blessing because I think it gave people the chance to think and to recognize some of the if not psychological, but definitely social problems that exist within our community, and to then seek out help. And certainly we're very thankful to our imams and scholars in our communities that have really done the work because you know, they have the trust of the community. So when an imam and a scholar you know, from the minbar or from the position that he or she holds, then they speak about the importance of mental health, the community responds well. So, you know, I'm going to share my screen. I have a few bullet points that I wanted to go over and talk about. First, really, what is therapy? I think a lot of times when the word therapy, psychotherapy, counseling is mentioned, we tend to have a strong reaction to what it is. Oftentimes because we just don't know what it is, and it sounds very scary. And the closest word that, the closest, I guess, idea that comes to mind when we think of therapy is like physical therapy. So we're assuming there's some kind of intervention that's going to be perhaps painful. There's also the thought that it's you have to be very vulnerable and you're sharing things. So is the person going to keep this secret and confidential? So there's just a reaction towards the term therapy and counseling. If I'm to describe this from an Islamic perspective as a Muslim psychologist, I usually go back to the teachings of, well, first I ask the question, to myself, and I urge everyone to ask is, how do you know if you have a problem, right? How do we know if there's something wrong? Can I individually be the judge or be the best judge to recognize my own problems, my own deficiencies, my own character flaws, my own psychological issues? And I think if you're being honest with yourself, if we're all being honest with ourselves, the answer is really no, you can't. I mean, you can maybe work towards becoming someone and become a really aware individual who's really hyper aware and has humbleness and humility, but still the idea that and this is why we also have prophets, right? Like the prophet knew better than all the human beings, right? And Allah, we say Allah knows best, because ultimately, even with all the knowledge that we may possess, we will still lack. There will still be that gap that exists between the problems and the issues that we have, and not having full awareness of it. Imam Ghazali, when he has his magnum opus is this Ihya al-Ulumuddin's 40 books, a lot of work that he's done in especially in the area of character development, recognizing virtues and vices, and going deeper than just the superficial Islamic rituals that prayer and fasting, and talking about what are the inner deeper aspects, philosophical aspects to these practices, so that when you're engaging in prayer, it's not just a chore, which oftentimes it does feel like a chore, but hopefully there are times when we can engage in it in a more meaningful experiential way so that we can benefit from it spiritually. He also wrote a small booklet, so if you're ever trying to understand Imam Ghazali, and especially from the context of like how does he talk about the human being and what makes us healthy, and how to work on ourselves spiritually. The smaller text is called Kimya Sa'adat, or Alchemy of Happiness. He wrote that in Farsi, I believe, originally, but in that he mentions, he starts it out by saying that, recognize that the key to understanding Allah, right, which is a goal that we have as people, as creation in this world. It's a very natural, even if you don't have like prophets or someone to tell you about God, it's like, who created me? How did I get here? And then to have a connection with that divine. He says the key to that is recognizing your own self, right? And we know from the Quran, and he quotes the ayah, سنريهم آياتنا في الآفاق وفي أنفسهم حتى إذا بين لهم أنه الحق. That surely we will show them the signs in the horizons and within themselves until the truth becomes clear to them. So he's alluding, or he's pointing us towards the fact that in order to recognize Allah, we have to recognize ourselves. And there's a famous saying which is sometimes quoted as the hadith of the Prophet ﷺ, but whether it is or not, authenticity is not there, but which is man arafa nafsahu faqad arafa rabbahu. Like whoever knows himself knows his Rabb, his creator. And so when you ask the question to yourself, if we're being honest, and we say, do I really know myself? Like, do I know why I do the things I do? And if I do know why I do the things I do, like for example, if I'm engaged in substance use, then do I know how I can stop it? And if I know how I can stop it, why can't I stop myself? Like, I think we're being honest, we recognize that we don't have a lot of self-awareness. We don't have a lot of awareness of why we engage in certain behaviors. Why do we have certain emotions? Sometimes in certain places, we have some random things that come up in our minds and some random thoughts and emotions. Why do we treat one individual different than someone else? Why do we feel more comfortable in one space and feel more anxious in another space, a lot of that awareness isn't really there. And so, like Imam Ghazali in the same page, he then talks about like when you're hungry, you need something. When you're thirsty, you need water. Why do you get thirsty? These are questions that you have to ask yourself, from the basic biological processes all the way to the psychological and spiritual ones. And so we have to recognize that there are parts of ourselves that are hidden, that are metaphysical, that are batin, right? There's the zahir and there's the batin, that which is apparent and that which is hidden. And so in order to get a better understanding of ourselves, it requires many different things. For example, meditation can do it, self-reflection can do it. But one of the things that Imam Ghazali mentions then is in Ihya, he quotes another hadith. He says that when Allah wishes good for his servant, he gives them an insight into his deficiencies, right? So he makes him realize what his problems are, what his deficiencies are, and where it's coming from. And then he says, in order to do that, there are many paths to it. One is you go to a sheikh, a teacher. They used to do that more frequently in the past among the Sufis. And you basically give yourself to the sheikh, and the sheikh then has the knowledge, to spiritual knowledge, to identify for you what's wrong with you, and here's what you can do. And sometimes they'll like ask you to do things like go clean the bathrooms, and go do this, and don't talk to anyone for 3 days, or go fast for a week. They'll give you different ways on how to work on yourself and on character affirmation. So that's one way, he says. Another way is to have a friend who is knowledgeable, and who has knowledge in these matters of recognizing, spiritual, psychological issues, character affirmation problems, and you sit with them and they guide you, right? So that's an equivalent of what we would call a therapist today, like someone, because nowadays our idea of friendship is very different. Unfortunately, it's very unhealthy, where we think that anyone who says yes to you is your friend, right? So if you're like talking to your friend and say, hey, I feel like I want to try smoking, or I want to do this, and it's harmful for you, it's haram, it's Islamically, or even if you were to consider the benefits and harms of it, someone who says yes to you and supports you, we think is a true friend. From an Islamic perspective, that's actually not a true friend, right? A true friend should be the one who needs to push you and say, hey, hold on a second, what you're doing may be harmful to you. And that's when you reckon, when one of the points here is choosing the right khalil, the right friend, the right companion, the right therapist. You have to find the one who will push you, who will make you uncomfortable. So Imam Ghazali is saying that you sit with someone who then identifies for you what the problems are, identifies for you how you can work on it, and then helps you through that. He also mentions in the same page that an enemy can tell you more about your deficiencies, right? Because the enemy can be very honest about, things that are wrong with you. And sometimes we'll have a reaction to someone who's making these comments, but if you really reflect on it, there might be some kernel of truth to that. So therapy is really that process of recognizing yourself, becoming more aware, having a better relationship with your own self, being aware of deficiencies, being aware of character flaws, being aware of character virtues and positive and aspects of yourself, so you can build on those, and facilitate. And that process is being facilitated through someone else. In this case, a psychotherapist or a counselor or a, whatever term, psychologist, whatever you want to use. And the goal is ultimately to have a stronger relation with Allah subhanahu wa ta'ala, right? Through having that higher level of awareness within for your own self. And who needs therapy? I think everyone can benefit from therapy. I mean, it doesn't mean you have to go see a therapist. And I say that because there's some people, if I was to look at it as a continuum, which is how we should look at it, there's some people who have very severe psychological illnesses. Some individuals who have very severe psychiatric illnesses that require medication, where therapy might not even be beneficial, right? Someone who is like manic bipolar, or they're schizophrenic, or in that time when they're manic or having a psychotic break, therapy might not be effective. They just need medications. Someone who's severely suicidal may need to be kept in a safe unit for at least what they do here in the US, like 72 hours. So that's one end of the spectrum. But if you come down from it, then there are people who have psychological problems, personality disorders that have developed over time, and they need therapy. They need a therapist. They need professionals. And then if you come from that spectrum, you see people who have even spiritual illnesses, or even before spiritual illness, or alongside with spiritual illnesses, people who have, I guess you could say, sub-threshold psychological issues. So they have anxiety, but it's not to a point where they can't leave their home. They have depression or sadness, but it's not to a point where they're isolating themselves. So it's not like clinical, but it's subclinical. Those people can also benefit from therapy because then it'll protect them from going into that clinical range. Or they can still work on, like I said, spiritual issues, right? Character reformation. In Islam, the term, tazkiyat al-nafs or tahdhib al-akhlaq is used to identify this process of like working on strengthening and elevating your character so you can be a better Muslim and striving towards the perfection that Prophet ﷺ embodied. And if you come from that, you might just have some spiritual issues, right? You might be someone who gossips more, or someone who's got some, jealousy and hasad. And we know jealousy is a precursor to psychological problems, right? I also want to identify that having sadness and anxiety is not a bad thing, right? I mean, if you look at the spiritual Sufi literature, they talk about the idea how, it's a healthy process to have some sadness. It's okay to feel sad. It's okay to cry sometimes. It's okay to have anxiety. I'm presenting right now, I have some anxiety, and that's a healthy anxiety. But all of these things, this whole spectrum that I'm talking about, most of us will fit into that, right? There's only few of us who are, alhamdulillah, mashallah, have a really nice, amazing character. We don't have these character flaws. We don't have any struggles and psychological issues, and we're able to manage our life. That's great. But most of us, including myself, we need that support. So that's what therapy, that's when we might need. And you have to recognize where you are and what type of therapist then you choose. You might just need a spiritual counselor. You might just need a friend or a teacher in the community, a sheikh perhaps, or you might have a friend who's already like, you have that relationship with them where they can be honest with you about what you're doing and challenge you. So that can be your quote unquote therapist, although you don't want to put too much on them if they're not able to manage. And, but most people who are living in the West have access to therapists. And then there's obviously different forms of therapy. There's, group therapy, individual. I do want to highlight the importance here, especially for professional counselors, psychologists, psychiatrists. Confidentiality is the most important aspect. It's one concern that people always have is, I don't want to go talk to people because I don't know who they're going to talk to. What if I see my clients all the time in the mosque, and, initially when I meet with them in the office, I tell them, if I see you, I'm not going to approach you because I want to protect you and your confidentiality. I don't want people to assume and try to make connect the dots and say, oh, why is this person talking to Dr. Fahad? Is he his client? Because people know me as a psychologist. So we do our best to make sure that the confidentiality is kept. We have to, by law, ethically, Islamically, right? The hadith of the Prophet, man satara Muslim faqad satara Allah fi dunya al-akhirah. Whoever covers the faults or covers the deficiencies of his brother, Allah will cover his deficiencies in this world and the next. So as Muslims, that's our belief. As psychologists, as part of our ethics, and legally we're bound to do that. So it's important to keep that in mind. Now, choosing the right Khalil, and Khalil is a word that is, I guess you could say shameless plug for Khalil Center here as well. But the word is to describe a close companion, right? Rasul said, "Al-mar'u ala dini khalilihi," right? A believer's deen, faith, is upon his Khalil, his close companion. So he said, "فَلْيَنْظُرْ أَحَدُكُمْ مَنْ يُخَالِلْ." So be careful amongst you who you choose as your companion. We know through suhbah, through companionship, it affects the way we are, right? Like, I remember when I was doing one of my internships, and one of my supervisor would use like the F word. Every second word out of his mouth was the F word. And when I was sitting at home one time, and I just, like without even realizing, said the F word, and my wife caught me and she said, "Wait, hold on a second. You usually don't do that. Is everything okay? Like, this is like not how you normally talk." So I realized that just spending time with this person, 4, 5, 6 hours a day, it was rubbing off on me. So naturally, when you spend time with people who have certain qualities, those qualities will come into your character and your personality as well. So this is why we have to be careful, who do we choose, right? Now, I don't want to scare people and saying, well, like be so careful that don't go to therapy. I think I often tell people who were looking for Muslim therapists that it's better sometimes to get therapy, to have some therapy, instead of like not having therapy, because sometimes in an attempt to or in a search to find a Muslim or that perfect therapist, people just hesitate and don't go to therapy at all, which is not healthy. So some people definitely need therapy and they should go. But if you have the opportunity, the luxury, if you have access to more therapists, feel free, go talk to someone, 3 4 sessions, see how it is. Does the personality match? You can find the best therapist in the world, and still not feel that connection with them. So there's no guarantee that just because a person is world renowned and has awards or whatnot, they're going to, it's going to work with you. That connection, that match has to happen. So certainly keep searching, but also be very careful, because sometimes what ends up happening, and this is the same mistake we make with friendships, like I said before, when we're looking for a friend, we are inclined towards the one who just says yes to us and doesn't push us, doesn't challenge us. You also don't want a therapist who just blindly says yes to you and doesn't push back, right? So ideally, you should feel comfortable and have enough trust, and for them to then be able to push you back on things that are happening with you, or challenge you, right? Make you uncomfortable. Therapy is meant to be uncomfortable. It's not supposed to be this place, like I said, in physical therapy, when you go, or if you go to the gym, for example, right? You have to feel a discomfort for growth, for healing to take place. And the same thing is in therapy as well. But you have to be sure that that's a safe place for you. If you do feel uncomfortable, if you have a panic attack, if you get triggered, inshallah, the person is there to support you through it. And sometimes, just like if you go to the gym, now I can't use that example because I don't go to the gym. I wish I'd worked out more frequently, but if you go to the gym and work out for a few days, your muscles are going to be so sore you can't even move your arm. But it does pass, right? Eventually, it will, like, you'll get through it. But your muscles have now been built. Now you can go and bench press, a higher amount than you did before. So therapy is the same way. It's very normal in the beginning for a person to have a drop in their functioning, for them to feel more depressed, more sad, more anxious, because that's required for them to then be built back up. Sometimes that can take months and years. Sometimes that can just take weeks. So that's completely fine. And I'm just going to end with some recommendations, right? Just as how to be healthy communities as Muslims. First off, I think the 3 things that if everybody focused on, I think it would eliminate, probably half of their psychological symptoms. Being active, right? Some kind of physical activity. We unfortunately live in a time where we're kind of like getting used to, even when we're driving now, our cars are automatic. So before, we used to have like, we have to be aware of what we're driving, and we're moving our arms and our foot, our feet. But now, the cars are driving themselves. So we're coming to a point where you don't have to do anything. So doing some kind of physical activity is very healthy. Taking a morning walk. I was just reading a research that talked about even listening to birds chirping can actually help alleviate your mood. It can help you make your mood positive. Even for those who have clinical major depressive disorder, for up to 8 hours or so, it affects their mood just by listening to birds chirping, right? Spending time in nature. As Muslims, we should do that, because like the Quran says, like the ulul albab, the people of intellect, what do they do? الذين يذكرون الله قياما وقعودا وعلى جنوبكم ويتفكرون في خلق السماوات والأرض. They're remembering Allah, whatever they're doing, and they're spending time in tafakkur, in thinking on the creation of Allah, right? And I can't think on the creation of, maybe I can if I do my best. It's a lot better if I'm outside in the creation, in nature. I'm looking at a tree, I'm looking at animals, I'm listening to birds, I'm looking at water, I'm looking at lake or something, or mountains and clouds. Then I can start reflecting on the creation of Allah. So staying active, sleep is probably one of those things that it's the high correlation with a lot of psychological issues. So making sure that we're following the Sunnah of Rasulullah, right? Which is after Maghrib, he would eat and then after Isha, it was basically time to go to sleep, right? Most of us, unfortunately, were up to like 11, 12. We have blue lights, LEDs in our houses, so our brain doesn't really know if it's day or nighttime. Melatonin isn't secreted, so we're not really. So sleep hygiene is important, and you can go Google what are the practices for having healthy sleep hygiene. Waking up for Fajr is really important. And then that could be the time when you do the morning walk, for example, right? Spending that time alone, talking to Allah subhanahu wa ta'ala, really having that deep, meaningful, mystical connection and experience with Allah subhanahu wa ta'ala can be very helpful and a protective factor for a lot of psychological issues. The other thing is meaningful social connections, right? We know one of the largest studies done in Harvard, right, on mental health talks about how meaningful social connections can affect one's happiness, right? So having those connections, spending time with people, and disconnecting yourself, going offline from your phones and your computers. When you're with people, put our phones away. Let's talk to each other, even if it's 5 or 10 minutes. At least with the family members, with your spouse, with your children, parents, siblings, spend a few minutes a day just sitting and talking to them without like your mind being occupied or something in your hand, or sometimes even when your phone is with you, like your mind is just kind of focused on that, and then you have like this phantom buzzing and you're thinking someone's messaging you and no one's messaging you. So it's just a very unhealthy relationship we have. And then spending time alone, right? Unless you're depressed and you have the tendency to ruminate and become more depressed, take some time to really spend some time alone. I mean, Fajr time is really good time when you're walking outside. If you listen to music, or if you're, sometimes I listen to podcasts, that's fine, but sometimes take that away and just kind of spend that time in just thinking and focused on what's present, being mindful of what's there. And then the last thing, which is very important, is being very mindful of our subjective states of emotions. Unfortunately, we live in a time where there's a lot of validation about what I feel right now, right? In my last presentation today, I was talking about how in a healthy marriage, you go through a time after honeymoon phase where you don't like the person you're married to. You can start considering divorce. But that's a very subjective state. And oftentimes it's not because there's an objective reason, like someone is verbally, physically, sexually abusive. It's actually because you just don't feel happy, right? That feeling, if I bought a new car and I think I'm buying a new Tesla is going to make me happy, and I buy that Tesla, after driving it for a few days or a few weeks, I'm going to not feel happy with it. I mean, it's just a normal and natural thing. If I buy a new phone, same thing's going to happen. So be very mindful and careful about being too focused on your subjective experience and feeling, and then taking actions based on that. Challenge yourself, push yourself through. Like I said, the only way we can build muscles and become resilient is if we allow the discomfort, if we embrace the discomfort. So be okay with that. But certainly if there's abuse and if you don't feel safe, those are extreme cases where you should seek some help. So inshallah, I'll end with that. I think I've gone way over my 15 minutes, but hopefully that was beneficial. And if there are any questions, I've left my email here as well. Feel free to email me if you don't want to ask here, but I'll hand it back to Hamad.
Jazakallah khair, Dr. Fahad. We really appreciate this really important topic of therapy engagement. How do you find a therapist? We actually had a lot of questions, and you actually answered majority of them in your presentation, so that was wonderful. We have about 5 minutes left that we're going to use for Q&A, so we do have a few questions for you. So the first one is, so you mentioned, trying to find a good match with the therapist, right? So if the first few sessions with a therapist is going to feel uncomfortable and one might feel more depressed before things get better, how can we differentiate between the therapist being a good match for us or not?
Yeah, that's a very tough question, because then I have to question what I said about subjectivity, right? So part of it is like the subjective feeling of like, the connection that you might feel with a therapist. Sometimes it takes a little bit of time. Also, your own personality comes in. For example, like if I'm an introverted individual, it's going to take me a little bit longer for me to become comfortable with someone versus there are people who are very social extroverted. They are able to like befriend and connect with individuals a lot quicker. I think, and then also the style of therapy, right? So like there's some people who are looking for a certain style. I remember, many years ago, I had a high school student who came in for therapy, And my style is usually that I do a lot of listening, but I also like ask questions, and I do direct and guide the process like in the session. And I remember him saying to me, I just want you to listen to me. I don't need you to ask me questions, right? So he was looking for that type of therapy. So I think the styles of therapy can also matter. I hate to use the analogy for like Muslim group, but I guess it's very common now anyway, which is that finding the right therapist is like dating, right? So you have to sometimes go through different people, and then like you might feel comfortable enough. It's not going to be 100% comfort, but at least knowing the basics, which is this person is here to help me. Hopefully they're not going to project their own issues onto me. Hopefully, and definitely they're not going to break my confidentiality, my trust. And they're going to take me and accept me the way I am, without judgment, right? That judgment piece, there's a difference between someone judging you versus someone challenging and pushing you, right? So if the person is providing these things, I think give it some time. And I say 4 sessions just because I think that's the minimum, but sometimes it might take a little bit longer. And the other thing is sometimes you might work with a therapist for a couple of months. I mean, since I started therapy back in 2013, my current therapist is the fourth therapist I've had. So, I mean, you just kind of like, okay, we've worked on pretty much everything. I think I've gotten whatever I needed from you. I'm just going to move on. And then you move on to someone else, and perhaps someone who has offering something that also can be very helpful to you. So, for example, sometimes you might go to therapy and you have some like relationship issue, and the person specializes in relationships, and you realize that maybe there's trauma in your past. So then you have to say, okay, you know what? Now I need to go to trauma specialist. There's different type of trauma therapists out there, right? Some do exposure therapy, some have like internal family systems, and what is it called? CPT, like cognitive processing, right? So you have to kind of like might have to try one or two or all of them, and or one of them might be more beneficial. So it's not just like one that you just choose forever, and you're going to be like with them till you die.
All right, wonderful. Well, we have time for one more question. So this is more of a personal question, but as an Islamic psychologist or therapist, what is your approach to working with clients who may have different levels of religious observance or understanding?
Yeah, I mean, I as a Muslim, first of all, and also as a psychologist, I'm not here to judge someone's Islam, right? So I have to meet them where they're at. Sometimes it's a little bit challenging. So, like for example, I had one client who was having difficulty with his Islam, and he said to me in the first session that he doesn't even know if he's a Muslim or not. And I remember that I ended the session, and the next session he said to me, he said, you didn't say salam to me. And I was like, oh, I didn't. And I told him, I said, I didn't say it because I wasn't sure. Like, I don't want you to have a reaction to me saying salam to you. So he said, no, 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 I'm here seeing you. You're a Muslim therapist. So I'm not like aversive to Islam, right? So it's sometimes hard to gauge, but I never push my own, understanding of Islam or religiosity onto an individual. I always meet them where they're at. I've had many clients who were brought in by their parents, and these teenagers are atheists or they're closeted atheists, and they don't want to talk about Islam at all. So I'm not even going to mention Islam in that conversation. And there's other people who come in and they're just sometimes very superficially, but they want Islam to be an essential part of the therapy process. So a as I've developed, I think I've gotten better at it. But a good therapist would be able to recognize and meet the client where they're at, not to try to put their own issues and their own beliefs onto the client. The other thing is, I think a lot of times people use Islam in a very harmful way, like in a very judgmental way, that they're if somebody is even having like thoughts of doing something un-Islamic, that people just become very judgmental. And like you have to take it easy sometimes. Even if somebody's committing a sin, it's not my place to judge them. In fact, committing a sin is a very normal part of being human being, and I have to recognize that, and I have to recognize that's what makes us human, and that's what brings us closer to Allah. So yeah, I don't think I think just having that awareness and not pushing your own faith and meeting them where they're at, is essential. And I think most therapists are able or should be able to do that, I would assume.
Wonderful. Jazakallah khair. So thank you everyone we're going to wrap up the webinar now just because we are getting close to our time limit. So I just want to thank everyone for joining in. We really appreciate you being here. And of course, a special thanks to Dr. Fahad Khan for enlightening us on the very important topics of Islamic psychology, therapy engagement. We all know this is almost like a taboo, or I mean, it's a hot topic within the Muslim community. So we're really happy to be kicking off the Meet the Expert webinar again after taking a little break with this special topic. Um, Again, Dr. Khan, he's with the Khalil Center. So if you do have any further questions or you want to get in direct contact with him, you can go to the Khalil Center's website. You can also email him directly. I think, Dr. Khan, was it what was your email address? I lost
On
it in the
Fahad at
chat.
khalilcenter.com. Yeah, I put it in the chat.
Fahad at khalilcenter.com. And then once again, as always, these webinars, these public Meet the Expert webinars, they are recorded. They will be published on this Institute for Muslim Mental Health's social media accounts, as well as our YouTube channel. And if we will be having monthly webinars with other experts within the mental health field. So if you're interested in this type of webinars, please stay tuned. We're going to be doing them on a monthly basis, inshallah. We'll have flyers and information about what's going on. But you can always go to the Institute for Muslim Mental Health website to see what new educational programs we're putting out there, as well as when the next webinar will be. So Jazakallah khair again to Dr. Fahad Khan. And for everyone for joining in, and we look forward to seeing you guys at the next one. Assalamu alaikum.
Wa alaikum salam.